And we are recording. So welcome to Generations Magazine, Brown Bag Webinar Lunch. This is our, fifth one, I guess, in our series. So today we have a very special guest, Travis from FEI, so Financial Financial Benefits Insurance, is going to share with us everything you ever need to know about Medicare. Well, actually, everything it would take us probably, 3 weeks, 4 weeks to cover. So he's gonna give us 90 minutes of what we need to know. And we wanna make this very simple for everybody. We wanna tailor it to your needs. So if, like I said before I started recording, if you have questions, just type them in the chat box or the Q&A box. Now, just a reminder, we do these webinars on the third Wednesdays of the month. And so that's from 11:30 to 1 o'clock. Now, the demand for folks wanting to present has really increased. So I've filled the entire year already. And so because of that, we're going to start adding the first Wednesdays of the month as yet another set of these webinars. And who knows, we may eventually be doing these every day. All depends on the demand and who all joins us for these and what you think of them. So the hope here is to build a network of resources of Kapuna services that are here throughout the islands, all islands. Not just share strategies, but get to know the different services that are available out here. And for the most part, these are partners with the Generations magazine. So they also write articles in our magazine and could also be on our radio show. So FBI here is actually a sponsor of the webinars, which makes it extra special to have them joining us today. I mentioned the radio show. So we have a radio show podcast that you're probably aware of. That airs on Sundays. So Sundays from 8 o'clock to 9 o'clock on 101.1 FM. It's Hawaii's oldies station. They also have a stream, and they also 883 on Spectrum. You can actually tune in that way. There is a Hawaii media streams it also. These are all recorded, both the radio show and the webinars, and they're all in our website, which is at generations808.com, as is our magazine. And the April-May edition just came out, so that's already been posted if you want to see that, and should be on the stands this week. So with that, I'm going to let Travis take it away, tell us all about Medicare. All right, Travis.
Okay, thank you, Rick. Okay, so hello everyone. My name is Travis Motosue. I'll be your presenter here today. Just a brief history about myself. So basically, I was in this business, even though I look fairly young. I'm 40 years old now. I got involved in this business back in 2004 when the Medicare Part D drug plans and everything started coming out in 2005. So basically, how I got involved in these plans was basically I was taking care of my grandparents back in those days, and then my uncle, my cousin were involved in insurance for a long period of time. And they said, "Hey, Trav, why don't you help out other people's grandparents as well, looking into these Medicare Advantage plans?" And I said, "Hey, you know what? That's fine. You know, I do like helping out take care of people. I like helping out seniors because I help take care of my grandparents. And then so that's the reason why I got involved with this Medicare plans, Medicare insurance, Medicare Part D drug plans, Medicare Part C plans, and things like that. Help out the seniors, making sure that you guys have the right plan for yourself." Okay, so here's myself. This is my wife, Jessica, my mom, my dad, who's also in this business. He was, after 35 years in Sears, he decided to retire and get involved in this business as well. This is my sister. She's also involved part-time in this as well as substitute teaching for the schools. And then my son, this is my grandparents over here. My grandpa, 96 years old. My grandma recently passed. This is also my son, Julian. He's about to turn 4 next month. And then my other son, Mason, he's 2 years old. This is a little bit older picture on that, but he's just turned 2. Okay. This is our office over here. So this is where I'm at right now, 1311 Kapiolani Boulevard, and right next to Ala on the Picoy and Kapiolani Boulevard, that corner over there. So if you wanted to ever, come by and visit us, you can always come by and visit us over there. We also do have a website as well. So if you ever want to visit our website, fbihi.com, you can always visit our website and check us out over there. Okay. And then we do have, like in our office, we do have social distancing kind of things where we do have plexiglass in all our offices. We do have, make sure as soon as you come into our office that you do get temperature checked, as well as we give you a squirt of hand sanitizer, as well as we require you wear a mask if you're inside with other people. Okay, I don't have a mask right now, just so you can hear me talk a little bit better and things like that. Okay. But over here, basically, this is the Medicare and You book. So this is a book that you guys probably get, every year. You guys get this around September, October. And this is maybe around 100 something pages. So a lot of times people don't really read this book. They pretty much get that book and replace it with the old book. Okay. For me, I gotta take my grandparents' book or my mother-in-law's book because it's pretty hard to get this Medicare and You book for if you're under 65. So that's what I have to do. But if you guys know everything in this book, then you guys are pretty well prepared because then you're very knowledgeable. But if you don't read that book, that's the reason why we're here, to help explain to you the different various complexities about Medicare. Okay, so basically I wanted to talk about, just jump briefly into how to enroll in Medicare. Okay, so how do you enroll in Medicare is that basically if you're currently receiving Social Security benefits, then you automatically get, and you're before turning 65, so receiving Social Security benefits before turning 65, then you're automatically enrolled into Medicare Parts A and Part B. Okay, so you really don't have to do too much if you're currently receiving Social Security benefits prior to turning 65, because that's actually when you can receive Medicare benefits. Okay, another way you can enroll is you can be able to enroll by, if you're still working, then you probably don't want to enroll yet, but you probably want to make sure you get Medicare Part A. If you're about to retire and not receiving Social Security benefits. So if you're in that category, what you can do is you can always go to socialsecurity.gov/benefits/Medicare, which we'll go to right now. So you can be able to enroll in these different things over here. And we'll talk about the ABCs about Medicare a little bit later. But basically, should you sign up for Medicare Part B? Yeah, so basically, should you sign up for Medicare Part B? That all depends, okay? Being that if you're in Hawaii, we're in Hawaii right now. If you're currently working, because Hawaii has a prepaid healthcare rule, it probably does not make sense for you to pick up Medicare Part B. Because if you're still working, Medicare Part B in most cases will cost $148.50 to receive Medicare Part B. And so if you're already working in Hawaii with the prepaid healthcare law, working 20 hours or more, why do you want to pick up a Medicare Part B and pay that money when you have a pretty good plan from your group medical plan? Okay, so I would say if you're still working, do not pick up Part B. If you're an employee working 20 hours or more. But if you're an employer and you have a group, then you might want to pick up that. Then we can talk to us. Okay. Another thing is that I noticed that some companies have been, if you're working and your company has under 20 employees, recently I know one carrier has been pushing their employees to pick up Part B, because there is that rule that if a company has under 20 employees on the group medical, then the employees should be picking up have Parts A and Parts B. Okay, and recently that one carrier has been trying to enforce that rule. Okay, because Medicare pays first. If your company has under 20 employees, Medicare will pay first, and then your group plan will pay second. If your company has more than 20 employees, then where your company plan will pay first and the Medicare will pay second. Okay, so if your company has under 20 employees, because Medicare would pay first, that's the reason why they would want to ensure that those people have Part B. Okay, so if you have questions about that, come and see me. Okay, or we can always email me or whatever, and we can be able to help you on that. Okay, if you did not pick up Part B, when you could have picked up Part B, and you only have Part A, then you can enroll in Part B in January to March 31st for July 1st effective date. Okay. Now there's other special enrollment periods you can enroll. So if you're working and you have your group medical plan, and then you decide to retire and you're losing your group medical plan, then that's another time you can be able to enroll. It's called a special enrollment period, which you can be able to enroll during that time, the 8-month period that they talk about. Okay. If you want to maybe if you're not picking up if you're just aging in and you're not taking Social Security, you can always check this box over here and apply for Medicare only. okay, not for Social Security. So that's another place you can check over here. A lot of things are done online nowadays, especially with this COVID-19 pandemic. A lot of things are done online, or you can always call and try to schedule an appointment to go in. Okay. But if you are employed and then you're losing your Part B medical, and you want to pick up your and you're losing your medical group medical plan, and you want to pick up Medicare Part B, then you can be able to download these forms over here, and you would have to fill out CMS Form 40B, and then you have to give the CMS L564 thing to your employer, and your employer will fill that part out, and that would make sure that you can enroll into Medicare Part B with no penalty. Okay. Okay, so if you have any questions about that, you can always come and see me. We can be able to help you enroll into Medicare Parts A and Parts B, or help you with any questions you have about enrolling into Medicare Parts A and Parts B. Okay. Okay, so that's how to enroll in Medicare. So now, when you're looking at kind of different kind of plans, now you always want to try to look and see which plan is right. So when you want to know which plan is right for you, I always say you got to look at 4 different things when you're looking at terms of which plan is right for you, because everyone is different. Yeah, everyone sees different doctors, everyone has different medications, everyone has different issues they're concerned about. Okay, so the first main thing you want to be looking into is your network. That's one thing you want to be concerned about when looking and choosing what kind of plan, Medicare plan you want to go with. Your network is always important. So you want to make sure that whatever plan you choose to go with, that the doctors are in clinics, hospitals, or in your network that you choose to go with. And also that they're accepting Medicare. I would say 98% of the providers in Hawaii are actually in the nation accept Medicare. So most of the providers in the nation accept original Medicare, but not all providers accept the other plans, like the Medicare Advantage plans. Sometimes could be PPOs or HMOs, which we'll get into later on. Okay, so let's make sure that doctor network is always important. The provider network is always important. Want to make sure that the plan you have or that you choose, that your provider is accepting that plan. Next thing important is formulary. Okay, so you want to make sure that the plan you're looking into joining, that the medications are covered. Okay, so you want to make sure you're looking at the formulary, medications are covered, but you also got to look at the cost of that too, because some plans could be a brand name medication with one plan, it could be a generic medication with other plans. Okay, and we'll talk about some other new thing that came about in 2021, a new kind of program that came about in 2021. Okay, another thing you want to look at in terms of what plan is right for you will be portability. Okay, the reason why portability is important, because you want to know, what if you do traveling outside the country, or what if you travel, you maybe have a second home in California or in Vegas or Florida or Texas, or maybe you want to visit your children in Michigan, or maybe like one of my clients, her daughter recently gave birth and she wants to stay 6 months in Portland to take care of her granddaughter. Okay, so how often do you travel, your duration of stay? Do you need care outside of states, outside of Hawaii, or while you're traveling in the various states? If you want to see the best, can you be able to see the best if the best happens to be on the mainland? Would that be an option for you? Okay, another thing you want to look at is cost. What is your budget? Now, some people are willing to pay a higher premium for having lower or zero co-payments. Some people want to pay the lowest premium and don't mind paying the higher co-payments because they say they're very healthy and they don't even go to the doctor nowadays. So everyone is different. And so those are the 4 things you want to make sure you're looking at is network, formulary, portability, and cost. So those are the 4 things it's really important to make sure you're looking at in terms of choosing what plan is best for yourself, because everyone is different. Yeah, but you want to make sure you find a plan that's best for yourself. Okay. Now, these are some important dates to remember. Now, this is for this year, this AEP and things, but for next year, these things got to change from 2020 to 2021 and 2021 to 2022 for next year. Basically, these things really didn't change too much. So basically, the important dates to remember is October 1st is basically the first time we can talk about the new plans for the incoming year. Yeah, so October 1st, 2020, we can first talk about the plans for the 2021 plan year. For this coming up 2022 plan year, we can talk about the new plans in October 1st of this year, 2021 for 2022. Okay, so that's when we can be able to talk about the new plans, but we cannot sign you up with any kind of plan until what is called AEP, Annual Enrollment Period, which happens from October 15th to December the 7th. That's when you can actually sign up with a plan. And whatever plan you sign up with last by December the 7th will be effective come January 1st. Okay, in January 1st, that's when the plan is going to start, and that's when you can try out the plan. If you don't, you find out that the plan is not really what you thought it was, or maybe you're talking to some other friends and saying, hey, you might want to try this other plan, or maybe you want to go back to your original plan you had before. You can do that. Come January 1st to March 31st, you can try out the plan. This is a period called OEP, Open Enrollment Period. So you can actually try out your Medicare Advantage plan or your Part D prescription drug plan. And if you wanted to, you can always go back to whatever you had before, or change back to whatever you had before during that time. Okay, that's actually, so that period is called from January 1st to March 31st. That's actually called a open enrollment period. So you can be able to switch from Medicare Advantage plans to Medicare Advantage plans, or you can be able to go to original Medicare, join a Part D drug plan. If you wanted to, you can also pick up a supplemental plan as well, which we'll go over those options shortly. Again, if you have any questions, you can always feel free to ask them in the chat box. I can be able to take questions as we're going along as well. Okay, so over here, basically is a quick look at Medicare. So anyone that's doing like when we're doing like Medicare 101s with providers, with various people turning 65 or aging in, a lot of times we're using this quick look at Medicare. Basically, we're going over the parts A, B, C's, and D's about Medicare. Okay. Now for this one, I'm not going to go that much into details on them, but I did want to briefly go over some of these parts because I think that you guys kind of know about them, but briefly a Medicare Part A is basically hospital. Yeah, so you pretty much pay a premium. As long as you work 10 years or 40 quarters, you receive Medicare Part A benefits. Okay, the reason why you receive them at no cost is because you're paying taxes for the 10 years or 40 quarters. Okay, so that's the hospital coverage. It also covers for hospital, skilled nursing, and hospice care. Okay, there's also Medicare Part B. So Medicare Part B, it does cover your doctor services, preventive care, things like that, your preventive screenings and things. There is a premium for Medicare Part B. Medicare Part B in most cases will cost $148.50. Okay, in most cases for 2021. And we'll go over the other costs later on in this presentation. Okay, so Medicare Part B, there is co-insurance involved. If you have Medicare Part B, there's a 20% co-insurance for that. Okay, Medicare Part C plans, also known as Medicare Advantage plans, came out, and basically that is a contract with private insurance companies through CMS. It has to be equal to or better than original Medicare. Also includes all those extra bells and whistles that you kind of hear attached with the plan, such as the dental, the vision, the over-the-counter items, the transportation, the acupuncture, gym memberships, and things like that. Also included in the Part C plans. Okay, and then we can go more into details about that later on. Okay, but basically with that one, for that one, you just have to make sure you see doctors in the network, or there's also a PPO plans you can go outside the network. So for the Part C plans, there's HMO plans, which you have to stay within the network. There's also PPO plans, you can go in or out of the network. Okay, the most important things about all these Medicare Advantage plans is it does have a thing called a maximum out-of-pocket limit. So that means that that's the most you're going to pay in worst case scenario. These Medicare Advantage plans have a thing called a maximum out-of-pocket limit. So if you ever do hit the maximum, after that, you don't have to worry about paying any expenses for that calendar year. Okay, so that's the Medicare Advantage or Medicare Part C plans. Medicare Part D plans, that pretty much is came about in 2005. So basically they came out with this plan because back in 2004, when they drafted up this plan, that's when all the brand name medications were expensive back then. And these were medications that people like Lipitor, Crestor, Fosamax. These are all things people saw as essential to their health because they help take care of high blood pressure, high cholesterol, osteoporosis, and things like that. But the thing is, back in the days, back in 2004 and 2005, all those medications were still brand name medications. Because they were brand name medications, people are worried. Do they pay for the rent? Do they pay for food? Or do they pay for the medications? So a lot of times, like clients back in the days in 2005, they were worried. Some of them were not even taking their medications because they couldn't afford the medications. Or some of them, because they couldn't afford too much, but they can afford a little bit, they took half that day, half the next day. Or I even had some clients going and mail ordering them from Canada or Mexico. I don't know about Mexico. Maybe Canada might be all right because, you know, Canada, some people, they're trying to make some deals about getting some generic medications over there. Okay, but I do know that that's the reason why the Part D drug plan, they try to come out with this to help out the seniors pay for the medications. So they brought this out in 2005 to help take care of the medications. Enrollment is voluntary in this Medicare Part D drug plan, but there is a penalty if you don't enroll. So I do have some clients that say, hey, you know what? I don't take any medications nowadays, so I don't need to pick up the drug plan. The only thing is, if you want to pick it up later on, then you're going to be charged a penalty. So that's the reason why, even if you're not taking medications and you have Medicare, it would be good to at least get something up, or at least some kind of credible drug coverage that you can get. And actually this year in 2021, there's even a very affordable drug plan. It costs like $5, under $6 a month for that plan. For those people that's not taking any drugs, you can pick up that kind of drug plan like that.
Can I ask a quick question on Medicare D? Is there still a donut hole kind of issue?
Yeah. Yes, the donut hole is always going to be there. So it's actually not called a donut hole anymore. So they actually want to stay away from the donut hole.
I Googled it.
Yes, no, they have, yes. So it is in there. First, they actually came out with the donut hole because when I first started working, it was like a donut. Yeah, very good in the beginning. As you get to the middle, there's nothing in the middle. So it becomes very horrible. That's what they call it, what the coverage gap is called.
Yeah, coverage gap.
Yeah, so that's what the coverage gap is called. So very horrible. And then it gets very good at the ending because you pay a lot lesser on the ending.
But could you explain that to folks that haven't maybe experienced that? What is that? So in the beginning, you're covered, but there's a certain copay that you do. And then when you hit the coverage gap, you have to cover your own medication for a period of time, like a spend down?
Yeah, so for the drug plan and things like that, for the drug plans, basically for the drug plans, you just got to see that they look at how much money you pay. There's always deductibles in most of the drug plans. There's mostly deductibles on most of the drug plans or Medicare Advantage plans with the drug plans. Okay, so for that one, basically, there's going to be, they look at the total, the deductible, and after you hit the deductible, then you're looking into your average co-payments depending on what tier your medications are. There's tier 1, tier 2, which is your generic medications. Tier 3 and tier 4 medications are your brand name medications, and tier 5 medications are your specialty medications. And so they look at, so you have certain co-payments on that. And then they look at how much money you paid, how much money the insurance carrier pays. Whatever the total cost of the drug is, if that ever equals $4,130, that's when you're going to fall into what is called the coverage gap. Okay. So look at what the total cost of the drugs are, whatever you pay and whatever the insurance carrier pays. Whatever the total cost of the drug is, if that ever equals $4,130, that's when you're going to fall into what is called the coverage gap, which when you fall into the coverage gap, that's when it actually was known as the donut hole, as what you're referring to. Okay, so when you fall into the coverage gap, formerly known as the donut hole, that's when you're going to pay 25% of the cost.
Oh, 25%. Okay.
Yeah. Okay. So that donut hole will never be closed. There's always, or the coverage gap is never going to be closed from what I understand. Okay. When I first got involved in this business in 2004 or 2005 plan year, we were under the impression eventually that coverage gap will be eventually closed completely. No 25%. Yeah. But there is always going to be this 25% coverage gap.
So once you hit the gap, then you're always paying the 25%?
Once you hit the gap, you're gonna pay 25% until you hit a thing called the catastrophic level. So to hit the catastrophic level, looking at how much money you paid out of your own pocket. If out of your own pocket comes out to be $6,550, that's when you're going to fall into what is called the catastrophic level. When you hit the catastrophic level, you're either going to pay 5% for your medications or 370 or 920 for those. 370 for your generics and 970 for your brand names.
Okay. So anybody that,
yeah, they say around 25% hit the coverage gap, slash the donut hole. Around 5% hit the catastrophic level. The reason why it's easier to hit the coverage gap is because of looking at the total cost of your drugs, whatever you paid and whatever the insurance carrier paid. Whatever the total cost of the drugs is, if it equals $4,130, then you're going to hit the coverage gap. But to hit the catastrophic level, you're only looking at how much money you paid out of your own pocket from the very beginning. Yeah, so it's a lot lesser numbers tallying up towards that coverage to get the catastrophic level.
So this is why we
starts over again in January.
This is why we need the brokers, huh? Because it's very complex.
It is kind of complex on that, yes. And that's the thing. Some people, I was under the impression that the coverage gap will be closed completely eventually.
Yeah.
Eventually, but that never is not going to happen ever.
And so
have not happened ever. Maybe some things might happen in legislation later on in my lifetime. But as of now, it's not happening right now.
So in Seattle, when this first started, I worked mental health, as you know. When they hit the donut hole, as we called it then, the coverage gap, many could not afford their meds. And so the state of Washington, the county of King County actually ended up covering low-income people that qualified for coverage. Is there anything like that for someone that can no longer afford their medication during the gap?
We'll talk about that shortly. Good
Okay.
question. We'll talk about that shortly.
Let me back up. So then Randall has some questions. You want those right away?
Yeah, whatever.
In chat. So Randall's asking, so Randall Mao, by the way, is our next presenter. So in May, let's see, I got it right here. I'll advertise it. May 19th, Randall Mao and Dr. John Ruckles will present Cardex. So there you go, Randall. Put a plug in for you. How many total Medicare plans are there to select from? Do we select from? I suppose it varies from year to year, huh?
Yes, there's a lot of different plans from year to year. So basically, if you want to look at the different plans from year to year, which we can do, hold on, get out of this. You can go to Medicare.gov, or you can also go look at the back of the book of your 2021 book. If you have the 2021 book, if you're 65, you can always look at the back of the book, and it has all the Part D prescription drug plans, all listed over here.
Okay.
Or you can go on what I'm showing right now, Medicare.gov, and you can click on Find Plans over here. You can continue without logging in, or you can log in if you wanted to, but I'd rather do this anonymously. I'm not even Medicare age yet. And then you can click on what plan you want to look at. So if you want to look at Medicare Advantage plans, if you want to look at just Part D drug plans, okay, but since you asked about Medicare Advantage, we'll do Medicare Advantage right first. So we'll put the zip code, we'll put our zip code in our office, 96814, or whatever zip code you're at, yeah. Wherever zip code you're receiving your Social Security benefits is actually the zip code you should be using. And over here, you can select whether you're getting extra help from Medicaid, supplemental income, Medicare Savings Program, Social Security, or if you don't know, or we're just going to say, I don't get any extra help from these programs. And we select next. Do you want to add your drug cost in here? You can add drugs over here or not. We'll just say yes, but we're not going to add any drugs. And you can see over here, there's many different plans over here, out here. So you can see there's the Advantage Patriot plan. That's the MA only plan from United Healthcare. There's also the Humana Plus plan. That's the HMO plan from Humana. There's also going to be the Humana PPO plan. That's a zero premium plan from Humana. There's also the United Healthcare ARP Advantage Choice Plan 1. That's a zero premium PPO plan from United Healthcare. There's Humana Honor Plan. That's the Humana's Medicare Advantage only, no drugs. There's also the HMSA Advantage, Akamai Advantage Complete. That's the HMSA Zero Premium Plan, PPO. There's also the HANA HMO plan. Last one, this one, I wouldn't suggest this one. This is like a HSA kind of deal. Not much people, I would say only maybe 7 people in the Hall of Hawaii signed up with that plan. And the people that signed up recently got off from what I heard too. So that's the LASSO plan. I wouldn't suggest that one. There's also the Ohana Plus plan, the HMO plan. That's the $18.80 one. So that there's 15 Medicare Advantage plans basically. There's also, I'll go over the other ones. There's also the ARP $55 plan for United Healthcare. Humana PPO plan, that's their $55 plan. There's also Kaiser Senior Advantage. They have the $78 a month plan. They also have the Akamai Advantage Complete Plus, $125. And there's also the Kaiser plan, $176 a month. So there's 15 Medicare Advantage plans in Hawaii. For this zip, every zip code is different now. Every island is different too. It goes by county. So let's make sure you look at everything goes by county. So even if I have a client, they moved from Kauai to Big Island because they wanted to have more space and they like the neighbors of the Koki frogs. They have to change plans because there are different plans on the Big Island versus Kauai. There's different plans on Oahu as there are from other places as well.
And then also, if you have somebody living out of state, like my parents are in a different state, it's different there as well. So
yes, everything is totally different, and so that's why you just gotta make sure you have a plan that's good for yourself because everyone is different, you know. But does that answer your question, Chad?
So that was Randall. So let's see.
Randall?
So then he goes on to say, I haven't read this yet, so I'll just read it out loud. Currently in your book of business of members you enrolled, what would you say percentage of breakout be for Medicare health plans, United Health, Humana, HMSA? I don't know. Do you do that kind of thing? Break them out at all?
I can't really break that out because I don't want to tell you which is the best and whatever.
No.
Everyone is different.
It's very individual. Each person needs to really, really take a look at it, listen to what each one offers to make your mind up.
Correct. So again, everyone is different. Everyone is different. I had a thing where one of my clients in Maui, she invited all her friends, had only 20 people in that room. They all signed up with the same plan that she signed up with.
Yeah.
The next year, half of them signed up with a different plan.
Probably,
like, why did we sign up with this plan?
Yeah, so the formulary, very important. Yeah, so with mental health, people would sign up to save money, right? So their guardians, these were developmentally disabled, mentally ill clients, their guardians would sign up for something to save money and then find out that their medications weren't covered with what they signed up for. So very important that you look at all the information before you make your decision. Yeah.
Yes, that's very important.
Hey, Travis, so is there a fee for your services, or how does that work?
No, there is no fee for our services. Basically, we just want to educate everyone. Yeah. And then you just want to make you knowledgeable about your plan so then you can be able to make an informed decision what plan is best for yourself. And then if you do enroll, then hopefully you enroll through us because we helped you with that knowledge. But if you don't enroll, don't worry. Yeah. Because sometimes people don't want to enroll in different things, or they have a good plan with what they had before from their former employer or whatnot. So everyone is different. But we don't charge anything, and you don't hurt my feelings if you don't sign up with me. I just want to make sure you're educated so you make an informed decision about what's best for yourself, as everyone is different.
Very good. Okay, I'll let you get back to your slides.
Okay, so that's with the Part D drug plan. Anyone have questions about the Part D drug plan? That actually was probably one of the hardest things for me to grasp when I first started working in this business. The Part D drug plan was the hardest thing to talk about. And that's the reason why I put more time on the Part D drug plan than the Parts A, B, and C. But I figured you guys already heard about that A, B, C's, and D's about Medicare. So that's why I kind of went over that a little bit faster. Okay, you don't have any other questions? Okay, so another thing I wanted to talk about is the Part D senior savings model. Does anyone know what the Part D senior savings model is? Does anyone? That came out in this year, 2021. Okay, so no one knows what that is. The Part D senior savings model. It's actually what I call the incident savings program. So this started in 2021. So this is a brand new thing that started this year. And that's a very good thing, especially if you're taking insulin. The reason why they started this Part D senior savings model is that 1 out of 3 Medicare beneficiaries have diabetes, which is pretty big percentage in my eyes. Okay, which means also over 3.3 million beneficiaries do take insulin. Okay, which in my eyes And there's also a problem in my eyes, there's no generics for insulin. I'm not sure why there's no generic for insulin. The reason being is because I do know if a drug has been out in the market for 10 years, then they should create a generic medication for that. But for some reason, insulins do not have a generic for it yet, really. Okay, so because of that, the high cost, they're all brand name medications. And so we can go and look to see the cost of these medications, because I want to show you what the costs are. So the place for me, what I like to use in terms of where to see the cost of medications, I like to use my friend GoodRx. GoodRx is the thing that I used back in 2011 when it first came out. I started using this back when it first came out. So this is a very good place for me to look to see what the prices of medications are, especially if maybe you don't have any drug plan, if you're under 65 and things like that. Okay, so we'll look at the prices of insulin. So we put insulin. And so we can see, and we'll sort this by order of cost, low to high. So you can see the price of the insulin is pretty expensive. It's not cheap, yeah? And I haven't even heard of Smegly, but Smegly is the cheapest one, $107. Now there's also Novolog, $143 a month, Novolin, $148, Humalog, Humalin, $231, Novolog, Basaglar. A lot of the clients are maybe taking Trudeo or Lantus, $442 a month. Okay, so these prices of insulin is pretty expensive. As you can see over here, $500, $700. Even the new one that came out, Xtolfi, is $1177 a month. Okay, so it's pretty expensive. And because the cost of insulin is pretty expensive, it gets kind of costly, especially when we're talking about that coverage gap. Okay, that we talked about earlier.
Could you tell them what website you're looking at there, Travis?
That was actually GoodRx. It's actually you can get it. You can download the application on it, or you can even go to goodrx.com. So this is the application that or a website I've been using from when it first came out in 2011. I like to keep up with different kind of things. So in my eyes, I like to keep up with all the stuff. So GoodRx I like to use for looking at medication prices. So you can get an idea what the prices are. Yeah, so over here, you can see the prices are pretty expensive. So because the prices are around, or average around $200 to maybe $400 for that, basically, when you do, or even some of them are like even $1,100, $1,177. Okay, so because of that, what happens is that when you hit with the Part D drug plan, with the coverage gap being $4,130 in 2021, then once you hit the coverage gap, you're going to pay the 25%. So because you pay that 25% of that drug, usually that sometimes during that time, you're going to hit this around July, maybe August, July, maybe June, May. Around then is when people call me up that taking insulin because they hit the coverage gap, at which you'll pay 25%. Sometimes that 20%, 25% comes out to around maybe $100 or so on that. And so that's the reason why they created the Part D senior savings model. So those plans participating with that senior savings model, if the people do enroll with those kind of plans, they only pay $35 per month for the insulin savings program, if the plan is participating with it. Okay. And that $35 a month does not apply to any deductibles and the coverage gap. So if you ever do hit that coverage gap, instead of paying 25%, you're only going to pay $35 per month for the insulin. Okay. Now, again, you got to note that not all prescription drug plans, PDP plans, or not all Medicare Advantage with prescription drug plans, MAPD plans, participate. Okay. So for that one, if you do take insulin, you might want to talk to a broker or do some research and see what plans participate with the senior savings model. Okay. Any questions? I think there's some questions that came up. Oh no, that's it. Okay, no questions. Nope. Just asking
just the website. Yeah.
Okay. So that's a pretty good thing. So the senior savings model is a very good thing. So those taking insulin, this is a blessing to those taking insulin, because if they join a plan that's participating with the insulin savings program, instead of paying that coverage gap 25%, they're only paying $35 in the coverage gap as well. and they don't have to worry about deductibles for that insulin.
That's a nice addition. Good to know that.
Correct. Okay, so that's why I want to point out that, because that came about in 2021. Okay. Now another thing, so this is the thing that you question about, Rick. So this is the one you question about. You need help with medications. Okay, so 52% of people in Hawaii qualify for a thing called extra help. Okay, 52%. So more than half of the people in Hawaii qualify for extra help. Okay, as long as they have Medicare, yeah. Basically, the qualifications for this, if you qualify, how to qualify, your monthly income gotta be under 1873 for singles or under 25 for couples, and have resources under $14,790 for singles or under $29,520 for couples, then you may qualify for that thing called extra help. Okay, which is a pretty big thing. Okay, so if you do think you qualify, 52% qualify for this, but not everyone knows about it. If you do think you qualify, you can always come and see us, and we can be able to help you qualify, help you show you how to enroll into it, help you qualify.
And then how much do they help with the copay? How does that work?
Okay, so how much do they help with the co-payment? So if you do qualify, a lot of times your Part B premiums might be paid for. Okay, that's $148.50 might be paid for. Also, if you do qualify, you're there's not subject to deductibles and not subject to co-payments for things, in terms of you don't have as high co-payments and things. So you're only going to pay maybe for your generic medications a $370 for generics and $920 for your brand name medications. Okay, as well, if you do qualify for LIS, low income subsidy, it also might take some, if you have a plan that has a premium, maybe it might reduce that premium by around maybe $20 to $30.
And then how do they apply for that? Is that just
so
online?
How do you apply for that? Basically, you got to go to Social Security online to apply for that.
Okay. But that's something you could help with as well.
And we can be able to help you apply for that as well, because even some of my clients, one of my clients, he said that he needed help with his drugs. I did this quick, analysis with him, and actually ended up running down that day to his house, because his house was about maybe around a mile away. So I ran down to his house, put my laptop in my hand. Good thing I have a small little laptop in my hand. The only thing I did, I signed him up for, I helped enroll him in it. I told him to call me when he gets approved, then we can, then that's great. But the only thing is, after that, I didn't want to run back, so I had my wife pick me up. But I did run down to his house to help him with that. So that's the kind of service we can give. If you're nearby my house, I can run to you in a mile.
Now, is this something that is this something that a pharmacist or a doctor would make somebody aware of, or is it consumer has to figure it out on their own?
Probably the consumer has to figure it out on their own. More than likely, the doctors and things aren't really aware of this. I will tell you, a lot of the. Okay, so yeah, a lot of people are not aware of this. My dad doesn't want me to find out what groups are aware of this, but a lot of people are not aware of this. Okay. A lot of locals are not aware of this.
And this has been around for quite a while, or is this fairly new?
This has been around ever since the Medicare Part D drug plan's been around for 2005. So it's been around for a while.
All right.
Okay. And these limits always increase once in a while. Okay. Oh. And the resources for singles, it does not count your house, your first house. Right. It does not count your wedding ring, and it does not count your car.
Okay.
Okay. So I do have a person. Maybe I not mention that, but you can have a nice house, you can have a nice wedding ring, you can have a nice car.
Yeah.
You can still qualify for this.
So this money, this is for couples or single. This is what you have in the bank, or is this your 401k also, or?
It includes your 401k, things in your bank, things in your life insurance that you can pull out, your cash value in your life insurance, so all your assets. The only thing it doesn't count is your first home. Yeah. If you have your second home, you got to count your second home, but it doesn't count your first home, your one car, and your wedding ring.
Okay. So Doug has a question. Why don't we have him go ahead and ask that? Doug?
Okay. Hi, Travis. Hey, thanks a lot for doing this. I am 68, almost 69 years old. And so I had to go through this Medicare thing and try and understand it. My situation is a little bit unusual, and I won't go through the whole thing, But if people are interested, there's a little write-up of my situation in the newest Generations magazine, so you can go to see that. Basically, of course, I'm on Medicare. I'm on early Social Security because I had to get that, but I'm also working full-time. So I have Medicare Part A, and then although my card says I'm on Part B, I'm actually, because of the Hawaii Prepaid Healthcare Act, I'm being covered by my employer, Hawaii Meals on Wheels, great outfit. And so I have Kaiser coverage. So what happens is the Part B amount gets taken from my Social Security and it goes over, I think, to Kaiser. And if there's any additional amount, my employer is paying for that as part of their obligation to provide Medicare. So my question is, should I actually retire? How do I figure out how much an equivalent amount is? I mean, what if I want to keep that same kind of Kaiser coverage? What's that going to cost me?
Well, then if you have the Kaiser, you have the Kaiser Senior Advantage. So if you like Kaiser, you have Kaiser, you like Kaiser, there's always a Kaiser Senior Advantage plan. And there's 2 plans for the Kaiser Senior Advantage plan that you can look into on that. And say hi to Sherry Lau for me. She's my classmate. I think that classes, yes.
So what are those costs? So I'd have to ask Kaiser what Senior Advantage plan that is similar to mine would cost.
Wait, what is what? Huh?
So my question is, how would I find out how much it would cost me to keep a similar kind of coverage?
How much would it cost to keep your senior kind of coverage? It's going to cost you for the Kaiser plan. It's going to be, have 2 plans. It's going to cost for your Part B premiums. I think you're already paying that right now.
Well, Part B, well, the thing is, the Part B, the amount automatically goes to Kaiser and my employer pays if there's any difference.
Yeah, so probably what they have, Kaiser probably has having you on, you're probably on your Senior Advantage already if you're paying your Part B.
Right. So if I no longer have an employer, which would be the case if I retire, how much is that going to cost me?
It's going to cost you $78 a month or $176 a month, depending on what plan you want. There's the Kaiser Senior Advantage. You have the basic plan or the enhanced plan. So it's up to you what you want to do on that one. Depends on what your situation is in terms of, your health and things in that.
And that's in addition to the Part B that's deducted from Social Security.
Correct.
I see. That's great information. Thank you very much. Yeah, appreciate it.
No problem. So you'll be surprised. When I first got involved in this business in 2005, or for the 2004, for the 2005 plan year, basically when I talked to some of the people, they retired because after I talked to them, because they were just working for their medical insurance. But then they realized that Medicare was pretty good. They decided to retire because they no longer needed to work for medical insurance. Okay, so good questions. Any other questions people had?
So in-home care services, Medicare cover any of that?
In-home care services, it does cover some basic in-home services. So sometimes people go to in-home services such as after they come out of the skilled nursing facility, maybe afterwards, skilled nursing facility, for some reason, the average stay in a skilled nursing facility is 14 days. So after 14 days, normally they tell you to go back home, but yet you're really not ready to go back home to per se, 100% to go back out to the real world yet. So they have what is called home health care. It lasts anywhere from a week to maybe 4 weeks, where they have a nurse, occupational therapist, or physical therapist go to the house, do some tests, do some exercises, and they'll leave. Okay, that's basic home care. That's the only home health care that Medicare covers. So Medicare is not going to cover the home health care, to watch over you, to cook for you, to babysit you. They're not going to do any of that.
No.
Yeah, the home health care, they're going to cover only basic. It's only going to cover to like nurses, occupational therapists, physical therapists, go to the house, do some exercises, and then they'll leave.
Yeah, not personal care or companion care, more medical kind of care.
Correct.
Yeah. And then the 100 days when you're hospitalized, can you explain that a little bit?
100 days in the hospitalized or 100 days in the skilled nursing?
100 days of Medicare cover. If you go, if an elder goes into a hospital that's on Medicare, they basically have 100 days of coverage.
Okay, that's not really. So I'll go over this slide over here. Hold on. Oh, I don't know if I can show this one.
No. Okay.
Wait, hold on. No, I don't know if you can see this on here. So hold on. I'm gonna try bring it up, but I'm not sure if it's gonna pull up.
That's okay if you don't have it in here. You got a lot to cover.
I can probably pull it up, but I can. Can you see the screen or the 2021 Medicare cost or no?
No. Still on the.
You know, it's not pulling up.
It's
not pulling up on. Maybe we can try pull it up on open with Chrome. Now you can see it, I think.
Yep.
Okay. So 2021. So this is the 21 cost. So these costs all change by year. Okay. So for the hospital stays over here, you can see over here on the original Medicare. This is under original Medicare now, not the Medicare Advantage plans, but under original Medicare. There is the first 60 days you stay in the hospital, it's $1,484. Okay, that covers the first 60 days in the hospital. That's your deductible. Okay, if you have to stay in the hospital longer than that, days 61 to 90, you pay $371 per day. Okay, then if you have to stay in the hospital longer than that, then Medicare is going to give you 60 lifetime reserve days you can use once in your lifetime. Okay, at which you pay $742 per lifetime reserve days. Okay, so first time through, that gives you 150 days of hospital stays. Okay, but just remember, they can only use those 60 days once in your lifetime. So after you exhaust those 60 lifetime reserve days, or after a one-time through in the hospital 150 days, after that, on your 151st day, what's going to happen is that Medicare is going to stop paying. Okay, because Medicare is going to stop paying, they're going to say, well, you can go out of hospital for 60 days, exhaust your benefit period, then you can go back into the hospital. But we know that, you know, if you've been in a hospital for that long, a lot of times it's pretty intense already, where your best chance of survival is probably to stay within the hospital. Okay, so that's where sometimes that Medicare Advantage plans could give you unlimited stays in the hospital, or if you have the supplemental plans for Medicare supplemental plans, they can maybe cover you up to 365 days as well, and things like that. Okay, does anyone have questions about the hospital? Now with the skilled nursing facility, that's for the 100 days. So with the skilled nursing facility, it covers you up to first 20 days under original Medicare, you don't pay. And if you stay in the skilled nursing facility longer than that, days 21 to 100, that's when you pay $185.50 per day. Okay. After that, then 100 days, that's what Medicare only going to cover you up to 100 days. The reason why is because the federal government did not want the Medicare program to be a long-term care policy. So that's the reason why they only cover you up to 100 days. So if you have to, you know, you're worried about that, past that, then that's when people pick up long-term care insurance, or, you know, there's also their children you can rely on, your children or your family or your friends. Worst comes to worst, it's also reverse mortgages, or there's also Medicaid you can rely back on. Worst comes to worst on that. Okay.
And you bring up Medicaid. So explain the difference between Medicaid and Medicare, just basically.
Medicaid is pretty much you have no money.
Yeah.
Welfare. So pretty much you have to have under $2,000 in assets and under $1,200 a month in income coming in.
Right.
Okay. Basically with Medicaid. But if you do qualify for Medicaid, there's very good plans out there for people with Medicaid and Medicare.
Right. I think Adrian put something in here back to Doug's question. He does not have to stay on Kaiser, correct? There are MA plans with zero premium.
Yes, he does not have to stay on Kaiser. He can always go to another plan. He can always go to another Medicare Advantage plan if he wants to. Just note that if a lot of times for me, if you have Kaiser, I'm not going to fight you in terms of getting you away from Kaiser.
Yeah.
Okay. Some people have Kaiser. They grew up with Kaiser. They love Kaiser. Yeah. Other people, they have Kaiser. They grew up with Kaiser. They don't like it. So everyone is different. Or some people don't grow up with Kaiser. They have HMSA or UHA or HMA, whatever, and they can be able to join another a Medicare Advantage plan. Everyone is different.
Very individual, definitely.
Yes.
Okay.
Yes. But
Thanks, Travis.
Kaiser people, they have to stay with Kaiser. They like Kaiser, so if they like Kaiser, that's for them. Yeah, everyone is different, and so that's why I treat everyone individually. I even have husband and wife with 2 different plans, 2 different companies. That's the way I sell. Okay, I want to make sure they're educated so they can make an informed decision what to do.
So we're turning 65. My wife is turning 65 this May. I didn't tell you. You didn't hear that here. What's the story on applying 6 months before your 65th birthday for Medicare?
You can apply 3 months before, the month up, and 3 months after to receive Medicare.
Okay. And if you don't apply for some reason, maybe you're working on a person.
If you don't apply, you can always go to the Medicare. You can always go Social Security, this site over here, and always apply over here.
Is there a penalty for waiting past the age of 65 to apply?
There's a penalty. If there's a penalty is 10% every year you did not pick up the Part B that you could have.
For the rest of your life.
Yeah, Part A, I would think as long as you work 10 years or 40 quarters, you or your spouse, you should pick up Medicare Part A because that doesn't cost you anything. As long as you work 10 years or 40 quarters. In
your best interest, yeah.
For Part B, there's that 10% penalty if you did not enroll when you could have. And if you did not enroll when you could have, you can always enroll from January 1st to March 31st for a July 1st effective date.
Okay. All right. Thank you.
Any other questions came up?
None others. Oh, here. Yeah, there is one actually. Hold it. Do you broker all Medicare plans or do you not participate with some?
I broker most of them. I don't represent all of them, but I broker most of them.
Okay.
Okay.
So the 15, how many do you broker?
On the 15, plans available, 13, 11.
Okay, thank you.
I represent all the Medicare supplemental plans though. There's some agencies that don't have all supplemental plans. As mentioned, we do a lot of plans, especially supplemental plans. Our agency might not be the biggest. Okay, that's it. I'm not going to talk about my agency, but we do really good.
Okay, yeah, you guys do. Thank you, Travis.
Okay.
Oh, another question. Let's see here. Oh, no, just asked it.
Okay.
All right, carry on.
Okay, so hold on. I got to get back. Not sure how come it makes me go back to the very beginning, but that's all right. Okay, so that's what the extra help LIS. Now another thing I want to go over is the Part B premiums. So not everyone, some people, if they're making good money, yeah, you might not be able, you might be in this stage. If you're making more than $88,000 as a single or more than $176,000 as a couple, you may pay a little bit more for your Part B premiums. And you may pay a little bit more for your Part D premiums if you have a Part D prescription drug plan. So just wanted you to be aware of this when you are signing up for Medicare, that if you do make more monies, you will probably have to pay more monies because the federal government assumes that if you make more monies, you can afford more monies. And when I talk to people that are in this category, they shake their head, but they know they can afford it and they just pay it because they know they can afford it. Okay, and recently they added in this, it used to be 5 groups, but recently they added in 6 groups. They added in this group of $500,000 plus. Yeah. Okay, so that's what the Medicare Part B and Medicare Part D premiums. If you do make more money, you could probably be paying more money. The reason why I want you to be more so concerned about this, if you're selling like your IRA, cashing out an IRA, 401k, selling a house or different things like that, just be aware of that. Yeah, because I don't want you shouldn't be cashing out, maybe if you're married together, you shouldn't be cashing out $223,000. Yeah, because you would pay a lot more, $90 more than if you only cash out $222,000 if you're just filing jointly. And this one also goes back 2 years. So for 2021, looking at your tax returns in 2019. So for next year, 2022, they're looking at your 2020 tax returns. Okay. Now over here, this is also different options you can be able to go with. Yeah, on your Medicare choices. There's Original Medicare. Original Medicare have the A and B, and you also can pick up a standalone Part D drug plan. And if you're worried about that 20% co-insurance or that, you know, the charges you went over to the hospital, you can always pick up Medicare supplement insurance, also known as the Medigap insurance, because it fills in the gaps of that 20% or the original Medicare has. Okay, so that's one option. Another option you can look at is a Medicare Advantage plan. Medicare Advantage plan is like a Part C plan. Usually has a part, in order to sign up with this, you have to have Medicare Parts A and Parts B. Usually it comes with a Part D drug plan built inside, or there's also plans that are just MA only plans, no drug plan built inside. Okay. Now, if you go on a supplemental route, basically these are all the plans you can look at in the supplemental routes because it covers, has many different plans. Plans A to Plan N. Most people, if you're looking at these plans, most of the people look at either Plan N and Plan G, or Plan F if they're turned 65 before 2020. You can still enroll into Plan F. Okay, there's also a high deductible F plan and high deductible G plans as well that some people gravitate towards as well. Now that's Medicare supplemental plans though. Yeah, those ones cost a little bit more than per se Medicare Advantage plans. But Medicare supplemental plans are pretty good because it basically fills in all the gaps of original Medicare. There's no network. So basically, as long as the provider accepts Medicare, you can be able to see them. Okay, that's important because some hospitals on the mainland only accept original Medicare, not a Medicare Advantage plan. So if you want to see the best, sometimes you might want to go with a Medicare supplemental plan. Supplemental plans, however, don't cover drugs. So if you go with a supplemental plan, that's where you probably got to look at picking up a standalone Part D drug plan, prescription drug plan. For this supplemental plan, basically, if you want to look into this, I would say you want to probably look into that definitely and when you're turning 65 or when you're just losing your group medical, because there's that during that time is when you can be able to qualify as a guarantee issue. Okay, so that means there's no underwriting on that. Okay, so people that look at the supplemental plans usually are the ones that want portability, want to go see the doctors in the mainland and things like that. They also possibly might be maybe the unhealthy ones. They rather pay a higher premium and not pay anything when they go and see the doctors and hospitals and things like that. So it's good for people that are want to see the best, or also good for people that are have a lot of medical bills and don't want to worry about authorizations and things like that. Then they can look at the Medicare supplemental plan. Okay, but Medicare supplemental plans a little bit more costly than the Advantage plans, but there is a place for Medicare supplemental plans. Okay. Now another thing is the Advantage plans, which we went over. Okay, so where do you go? Yeah, so there's 3 different places you can go in my eyes. A lot of times you have the employer group plan that could make help your decision. Okay, so I would say if you're a state retiree, you really got to look into the benefits because actually your state retiree benefits are good in most cases, unless you're under the new plan or unless you didn't work the years and that state retirees retired from the EUTF, HSTA, SHOPO firefighters, HGA, UPW. They have a really good plan. Okay, so for those people, more than likely you probably stay on that plan unless you're unlucky like me. My wife got into the new system for the state retirees, so she gets that good benefit, but I don't get it when I turn 65. So for that case, then I'm going to have to find a plan. Okay. Also, some employer groups like maybe VA, TRICARE, federal retirees and things, they have a good plan, but for them, they might want to look into plans that can give them additional benefits at no additional cost, or possibly there's even a new plan that came in 2021 that can also leave some money in your pocket through your Social Security checks. So those kind of people still might want to look at it. If you're a federal retiree, VA, or TRICARE recipient, you might want to give us a call. We can probably talk about your other options into those kind of plans. Okay. The other option is to go supplemental plan. You go straight, you go right, you can go Advantage plans. Okay. But the choice is up to you. Everyone is different. Okay. So what's best is always talk to a broker. We can be able to help guide you in terms of which way to go. Okay. I did made a little chart over here, supplemental plans or Advantage plans. So over here, I kind of made it kind of a little bit check box in terms of what is good and what is not depending. So guarantee issue, both of them in a way have guarantee issue. Before I was saying a new thing that made a difference in 2021 for Advantage plans is that Advantage plans did have health underwriting before, in terms of we couldn't sign up anyone with end-stage renal disease. Okay, so in my eyes, they had discrimination. But in 2021, this year, decided to take away that discrimination, and they allowed people that have end-stage renal disease to sign up with Medicare Advantage plans if they wanted to. So that's a new change they made in 2021 as well. Okay. Advantage plans have a little bit lower premiums because they have 0 premiums. They have premiums maybe $178 and things like that, or maybe even have a premium that gives you money back into your own pocketbooks on a Medicare Advantage plans. Medicare Advantage plans have networks though. So there's HMOs. HMO, if you do a Medicare Advantage HMO, make sure your doctor is and your hospitals are in that network that you sign up with if you do go with the HMO. If you go with the Medicare Advantage PPO, you can go in or out of the network depending on that. Some PPO plans are a little bit more flexible than others on that. Medicare supplemental plans have underwriting unless you're turning 65 or losing your group medical. So that's why Medicare supplemental plans is something, at least when you're turning 65 or you're just losing your group medical and getting Medicare, that's something you want to at least look into, because supplemental plans there are no underwriting per se if you're just aging in or you're just losing your group medical. Okay. Advantage plans, as mentioned, there's no really underwriting on that. The only question we were asked before was end-stage renal disease, but in 2021, we cannot ask that question anymore. Okay, so if you have end-stage renal disease and you want an Advantage plan, you can do that in 2021. Advantage plans do ask that you have a primary care doctor, especially if you have a HMO plan. If you have a PPO plan, you don't have to do that. Medicare supplemental plans, you can enroll at any time. You can also disenroll anytime. Versus Medicare Advantage plans, you can only enroll during that AEP time, October 15th till December 7th for January 1st effective date. Or you can also change plans from January 1st to March 31st during the OEP time. Okay. And there's also SEP times as well that you can be able to enroll in during that times. Okay. Medicare supplemental plans are more portable because basically as long as the doctors or the hospitals accept Medicare, you can be able to see them. You don't have to worry about no authorizations, worrying about no networks and things like that. So Medicare supplemental plans are a little bit more portable than Advantage plans. Medicare supplemental plans, because they're portable, you can travel in all the United States and don't worry about those kind of things. Versus Advantage plans, I have a question mark on that because it depends. If you have the HMO plan, the only thing you can go is urgent care or emergency room coverage on that. If you have the PPO plan, then you can be able to go outside the network, but you probably might pay a little bit more unless certain PPO plans allow you to stay with pay in-network fees for out-of-network providers if they're in that network on the mainland. Okay, Medicare Advantage plans have all those bells and whistles, such as the dental, the vision. They include the drug plan, so you don't have to pick up a standalone Part D prescription drug plan. And Medicare Advantage plans also have a thing called a maximum out-of-pocket limit, which is the most you would pay in worst case scenarios. Okay, any questions on that?
Oh, I'm sure there's a lot. I don't see any though.
No, I see one. If someone will live part-time out of the country, Japan, several months, will Medicare coverage be active with urgent care or physician's office visits with possible operating U.S. Medicare network doctors may not exist? Okay, so some supplemental plans do have coverage for urgent care or emergency room coverage, but they do not cover, none of the Medicare Advantage or supplemental plans will cover you for hospitalization in foreign countries. Yeah, so there's a fine line between will they cover urgent care and emergency room care? They do. Some plans do cover, even supplemental plans and Advantage plans do cover urgent care or emergency room care services in a foreign country, but it does not cover hospitalization in a foreign country. So if you're worried about hospitalization in a foreign country, that's when you're going to pick up travel insurance or foreign medical insurance. Okay, because Medicare does not cover those hospitalization in a foreign country.
Does FBI have those kinds of insurances?
Oh yes, we are. We do have several different things on there, and actually I do have participating doctors and retired doctors purchasing the travel insurance for myself.
Very good.
We have very good plans. We even went up with against travel agents, and our plans was half the price, and our plans was very good. Okay. What time is it?
We got 20 minutes. Do you want to?
Okay, so there's key enrollment periods. Touching up, there's key enrollment periods. There's always the IEP, so that's you can enroll 7 months surrounding your 65th birthday. You can enroll 3 months before, the month of, or 3 months after. There's also a AEP time we talked about is October 15th to December 7th. So that's the time you can be able to look at all the different plans, and whatever plan you last enroll with by December the 7th will be effective come January 1st. It's also called a SEP time, special enrollment period. So this is the times that you can be able to enroll. So like if you're retiring, losing your group medical, or maybe you're moving to another county, like my client that moved from Maui to the Big Island. They were able to change plans because they have different plans over there on the Big Island, different county, or moving from the mainland to Hawaii is different, or from Hawaii back to the mainland. Also another time, if you have Medicaid, you can be able to enroll every quarter. If you have low-income subsidy, you can also enroll every quarter. Also, there's another thing that they recently came out because of this flooding going around. It's another time you can be able to enroll. The flooding going on in Hawaii, because there's been the flash flooding that's been going on, that went on in what was that?
In March.
Probably around February or March, the flash flooding that's been going on. So because the flooding that's been going on, the governor issued a emergency proclamation. So because that emergency proclamation came out, if you wanted to change plans or join different plans because you're affected by the floods and things like that, you can be able to change plans up until July 31st for August 1st effective. Okay, so that's another enrollment period that's recently came out recently. Okay, there's another thing called open enrollment period from January 1st to March 31st that recently concluded. So that's the time you can be able to change plans. Another time if you wanted to. Okay.
Oh, what Medicare doesn't cover?
Do we have time for that? Do anyone have any questions? If not, I can fill up some of the time. My dad wants me to cover one more thing. But does anyone have any questions? So no more questions. I think my dad wanted me to cover one thing over here. What are Medicare excluded services? Okay, so Medicare excluded services, one thing is going to be your dental care. So Medicare does not cover dental. If anyone has any questions, just type them in the chat box. I can be able to answer them. If not, I'm just going to go over this to fill up some time. Okay, so Medicare excluded services, so dental care. So Medicare does not cover dental. When I first got into this business, I saw, oh, good, Medicare covers dental. However, that dental service that Medicare covers, it's only if you fall down, break your jaw, going to fix your jaw, not your teeth. Or maybe you have to get into do a surgeon procedure, the oral surgeon, maybe the doctor has to take out some teeth to do that procedure.
So people have to pay some kind of dental coverage or what?
No, so Medicare really does not offer you dental as we know it. We know dental as teeth, like cleanings, like fillings, like implants, like bridges, like dentures and things. So Medicare does not cover any of those kind of things.
So are people paying out of pocket? So are people paying out of pocket for their dental then? Is that what's happening?
Yes, people are paying out of pocket for the dental work. Unless you join a Medicare Advantage plan, it has some dental work built inside on some plans.
Advantage plan does, okay.
The original Medicare does not cover dental work as you know it. The only dental work is going to be like if you fall down, break your jaw, they're going to fix your jaw, not your teeth. Or if you're or maybe you have to do some kind of surgery to get into that mouth, they have to just pull out certain teeth to do that medical procedure, not a dental procedure. Okay. Another thing is Medicare does not cover most vision care. Okay, so most vision care is original Medicare does not cover routine eye exams or daily wear glasses. Original Medicare will cover you one pair of glasses after cataract surgery, but only a basic pair of glasses after cataract surgery only. After that, they're not going to cover you. Medicare will cover you for glaucoma things, balance issues and things like that, vertigo and things like that, but it will not cover you for routine eye exams or routine eyeglasses. or contacts.
So one question here. So back to dental, are there standalone dental plans?
There are standalone dental plans, but not in original Medicare. There are standalone dental plans that you can get off the market that we do have standalone dental plans. Or there's also some riders. If you purchase a Medicare Advantage plan, some Medicare Advantage plans have riders, or some supplemental plans do have dental discounts. If you join supplemental plans, some supplemental plans do have dental discounts.
And how about hearing aids?
So that's probably the next one. So hold on. Hearing aid, routine hearing. So that's a good question. So routine hearing does not cover routine hearing. It's only going to cover hearing for like looking at balance issues and things like that. But original Medicare does not cover you for hearing aids. Okay. So if you need coverage for hearing aids, you can either look at, a Medicare Advantage plan does have some hearing aid coverage built inside, or, if you don't have a Medicare Advantage plan, there's always, some of my clients go like, they've been going Costco. That's pretty affordable for them for that.
So it's to your advantage to have an Advantage plan. Is that what you're saying?
No, it's not everyone. Sometimes people don't want Advantage plans. So if you don't want an Advantage plan, there's always other things. But Medicare Advantage plans does have that routine hearing aids built inside on some plans. Not all the Medicare Advantage plans have the hearing aid coverage, but a lot of them do.
Okay.
And hearing exams too. Okay, foot care. So most foot care is not covered as well under original Medicare. Okay, so let's make sure, feet are important, especially for those that are diabetic. Yeah, you don't want to be like my uncle. My uncle is, he didn't take care of his feet, diabetics, and no longer has a lot of his lower feet and stuff like that. So just make sure you take care of your feet if you're diabetic. Okay. Most long-term care. So we touched upon that before in our other things about, when we're talking about long-term care stuff on skilled nursing facility, but Medicare does not cover long-term care in most cases. It does cover you in a way, skilled nursing facility up to 100 days. But again, if you have to be showing improvement. If you're not showing an improvement, they're going to ask you to leave. Okay. Alternative medicines. So Medicare does not cover alternative medicines. Yeah. So there are some naturopathic doctors though that do accept Medicare. Okay. But they don't really cover the alternative medicines that they do give, like, the supplements and things like that. But there are some Medicare Advantage plans that do have the over-the-counter items that you can be able to get, such as your vitamins and things like that, and acupuncture and things like that as well. So some Medicare Advantage plans also have acupuncture. But another thing to note about the acupuncture benefit, something new that they put out in 2021 is Medicare now covers acupuncture for 2021, only for lower back pain. That's original Medicare. Medicare Advantage plans have been doing that for a while now, but original Medicare decided to cover acupuncture benefits for lower back pain up to 12 visits, and then they can get another 8 visits, I think.
And this has to be doctor referred, or?
Has to be doctor referred, yes.
Okay. And back to long-term health, hospice, any coverage for hospice?
There is coverage for hospice, yes.
Okay.
That's under Medicare Part A, covers under hospice. So there is coverage for hospice for that. Okay, any other questions came up? Nope. Okay. Okay, so care received outside the U.S. So original Medicare is not covered care outside the United States. However, as I mentioned, supplemental plans helps do that, as well as Advantage plans help do that. The only thing is they don't cover for hospitalization in a foreign country. So if you're worried about hospitalization in a foreign country, that's when you pick up travel insurance or foreign medical insurance.
You have to do that before you travel, obviously, right?
You do that before you travel, but I even have it so some people they don't want they want the travel insurance, but they don't want to pay the higher cost, so they'd rather just have the foreign medical insurance, which mostly only covers for your hospital bills. And so what I do have some of those people that do that, they call me when they're already at the airport, because they know they're flying out at least.
Okay.
And then I sign them up while they're at the airport for the next day coverage, which will the next day will land at their destination. Okay. So I have people that are doing that kind of things as well. There's also coverage for the whole year for travel insurance too.
Oh, so Randall has another question. So if I am currently on my company's retirement plan with United Healthcare, when I do turn 65 and qualify for Medicare, can you discuss what will take place with my current United Healthcare retirement plan? Will Medicare become my primary plan and my current retirement United Healthcare become my supplementary plan?
It all depends. United Healthcare is a very large insurance company. They actually insure 1 out of 2 Americans in the United States. They insure 1 out of 2 Americans with medical coverage. So United Healthcare are very, very large. So with that said, they have very different. There are a lot of plans out there. I would say more than likely, probably that plan is kind of a group plan, not a Medicare, not tied in with Medicare. So in that case, yes, Medicare would be primary. The group plan would be secondary. But it all depends. I would have to check about that because everyone's situation all changes. It depends if that United Healthcare plan is has a thing called a Medicare wrap, where the drug plan is participating with the federal government drug plan to see if we can do something. If it is participating, we cannot do anything too much with it. But if it does not participate, which some of them that do not participate, he might be able to sign up with a Medicare Advantage plan with no drug and get additional benefits.
Okay.
Yeah, but we gotta call the administrator. So he can come and talk to us, and we can be able to talk to the administrator and see if it can be possible. Everyone is different. Every company is different on that. So we gotta check up on that.
Okay. So anonymous attendee here, how does someone make an appointment with you? This is a good place to wrap it up.
Okay, so someone to make an appointment with me, all they gotta do, I have my information over here. They can always just call me up on my cell phone over there, 808-542-5109. Just make sure come October, I think October 25th or something like that, 24th, you gotta use the 808 nowadays, coming in October. Later on, in any part of October, you gotta start now using the 808s. Cool. So this for some of the seniors, some of them you have in your cell phone, this has the first 7 digits. Yeah, so just make sure you guys dial the 808 coming the ending of October. Or you can also email me, Motosue@fbihi.com. Or you can also visit our website and things like that, because I do monitor the chat over there on our website. I got little other things. If you do go to our website and you want to chat over there, it goes directly to my cell phone.
Okay. Very good.
Schedule an appointment. We can do it. We can do meet up virtually. We can meet up talk over the phone. We can meet up in person at our office. I can come to your place. We can meet someplace else. We're very, very flexible. We also have several agents out there as well. We do have also an office in Seafood City. We also have a location in Hilo. And then we also have this place over here, 1311 Kapiolani Boulevard.
Okay. How long has FBI been around?
We've been around. We started agency in 2010. Yeah.
Outstanding. Okay.
So long enough. But I've been in this business from 2004. But we do have 56 agents representing our agency. So we're not the biggest, but we're not small either.
Okay. Really great information, Travis. Anything you want to say to kind of wrap it up?
So I just want to make sure that if you have any questions, problems, concerns about Medicare, you always feel free to give me a call or email me or whatever. Just make sure you note that, for us, we don't charge anything, but we want to make sure that you're educated. Our main thing is making sure you're educated so you can make an informed decision what's best for yourself. Everyone is different. Everyone has different needs, different wants. People see different doctors. People take different medications. People go different kind of places, and people have different things that they prioritize in their life. So I just want to make sure that you have a plan that's best for you. So you want to make sure you come and talk to us, make sure you're educated, and so you can make an informed decision what's best for yourself.
Yeah, it's really important to take this seriously and really spend some time on it. And so, yeah, very helpful to have someone like you, Travis, or FBI helping just sort it all out, because there is just so much information out there. And so Medicare has been around for a very long time, and there's many, many, many layers to it. And like you said, Travis, every year it's different. And so unless you know all of it, it's hard to decide what to do. Like you just shared a few things I didn't know that are new for 2021. So I really appreciate hearing all of that. Thank you.
That's why I wanted to. Sorry, I went over briefly about the part A, B, C, and D's, but I just want to go up briefly because I think everyone heard about that kind of things. That's why I want to touch upon things that people really talk about in this presentation.
So if you have questions, do put them in. We got just a few minutes left. So I just want to say, so FBI is our sponsor here for these webinars. And so at the first crack at the Medicare presentation, I think just very, very valuable information that was shared here. I think everybody would agree. And for our coming webinars, like I said, the next one is May 19th, Cardex. That'll be Randall Mao, who's with us here, and Dr. John Ruckles. And then 6/16, so June 16th, we're gonna have Brain and Body. That's gonna be a pretty interesting presentation. July 21st, Ludmila Home. So Dr. Poki Balaz is gonna talk about that and some Alzheimer's stuff. She was also on a radio show recently. And then August 18th, we have MDX, which is another Medicare program. September 22nd, SHIP. Again, on October 20th, we have MDX again, which is Medicare again. So that's when it gets pretty serious. So we're probably going to have FBI come back in. We'll have you guys choose what you want. October probably, I assume. Just another time during the enrollment period, and we'll just go to the next level. So with each Medicare presentation that we've lined up for our webinars here, they're each going to present something different because there is just so much information. And so if you're tuned into this today, I really would encourage you to keep kind of following this, especially if you're trying to help somebody with Medicare or yourself. It's just such important information. And then a good friend of ours, I'm with Hawaii Meals on Wheels too, along with Doug here. Doug is actually helping us with our IT stuff. So he's gonna upload this video for us, and it's gonna be available probably tomorrow on our website. Not only can you go in there and watch our webinars at any time, you're welcome to and encouraged to share them with anybody that you think could use them. Just send the link. This is all public domain, so we wanna get that information out there to folks. As you can see, there's just so much. November 17th, Michelle Cordero-Lee, Executive Director for Hawaii Meals on Wheels, is going to present. So we'll get the holidays kicked off there with Hawaii Meals on Wheels. And then December 15th, I have Debbie gonna come and present Gym Guys, some movement stuff. And there's a few other things that I'm lining up currently, which will be on the first Wednesdays of the month once I get them lined up. So we'll get that information to you real soon. Everything that we have here is recorded and it's all on our website. So generations808.com. Like I said, the new magazine is uploaded there already. That should be out shortly for folks to pick up a hard copy of it, but you can already be reading it if you like. And there's an article, like Doug said, about Doug, great story in there. I have a mental health column that I've started. This will be my third article, and this next one coming up. No, second one actually. And then just tons of information. But the radio shows are there and the webinars are there. So we treat them as podcasts as well. So please, check them out anytime. What is really cool, the way the website is set up, is if you just enter in the search engine a topic that you're looking for, fall risk, all the stuff that we have for all the 10 years that we've been around, it's all there and all accessible anytime, anywhere. Okay, so I want to, big round of applause to Travis. You're getting lots of thank yous coming in on all the questions and answers in the chats. Really, really appreciate your presentation. And I want to appreciate those that joined us for joining us. I hope you found this helpful. I sure did. Thank you.
Yes, thank you very much, Rick. Thank you everyone for attending this presentation. Hope you guys learned something, and have a good rest of the day.
I'm going to stop the recording, then you can say whatever you want.
Okay.